Hi again, everyone. Welcome back to my podcast. This is Patty, and it is my great privilege and honor to introduce my special guest today, Sean Duffy, founder and CEO of Omada Health. Sean, what a pleasure to have you on the show. Thank you for setting aside the time, and welcome to the show.
Absolutely, Patty. Honored to be on.
Thank you so much. So, Sean, for the benefit of our listeners, would you like to tell us a little bit about who Omada Health and how you actually got to start the company?
Yeah, absolutely. Happy to share the story. So, Omada Health is a virtual care company. We specialize in longitudinal disease areas. So, with a particular focus on chronic. So, those disease areas where you really need a lot of longitudinal, day by day support versus visit by visit support. And we offer an integrated care suite of services in prediabetes, in diabetes, in hypertension, in behavioral health, and in musculoskeletal. So that's really the mission. It's to do what we think digital can do best in healthcare, which is fill in gaps between visits. The company began actually as an internal project at IDEO. So I was in medical school, was in an MD MBA program at Harvard. I had worked at Google before, and between my first and second year in medical school, took an internship at IDEO and thought I was going to go right back to medical school, but I sat pretty close to this gentleman, Adrian James, who at that point ran medical products for IDEO. We became fast friends. We got a little bit of a time and budget to think about transformational opportunities in digital health at the time, and the result was Omada. So I asked the dean for a year off at med school and got it, and asked the dean for 2 years off and got it, and went back for a third, and they kind of cut me dry. So never ended going back to
Never
med
went
school.
back. Never went back. That's a story that
Indeed.
you hear once in a while from. But first of all, congratulations on all of the progress and the success. Just so our listeners are clear, when did you actually launch the company?
We founded in 2011.
2011. Okay, so you're 10 years
Yeah,
going
so
by
yeah, so
10
we
years now.
just
Awesome.
crossed our 10-year mark exactly. Yep.
Awesome, awesome. So who do you serve mainly? Is it providers, payers, employers? Is it more of one versus the other?
So the primary focus is on self-insured employers. That of course, as you might imagine, turns into many relationships with payers as well. So we contract as a provider, and in fact, we do have many partnerships with providers, especially the ones that are integrated and have their own health plans. So the likes of Intermountain Health, Kaiser Permanente, et cetera. But the primary operating model for Amada is to go to employers, share our vision on what care can be, and how a different approach in these disease areas might benefit their employees, both from a clinical outcome standpoint and economic standpoint, but also a satisfaction standpoint. And oftentimes they'll, once they get excited by Omada, see if they could find a way for us to work with their health plan to make the implementation easy and simple. So that's actually led to, in addition to the employers that we serve, many health plan partnerships as well.
Right, right. Now, you're still a privately held company, and can you share just for our understanding? I'm sure you have institutional investors. You want to just give us a little bit of a color on, who are your major investors and how much money you've raised to date?
Yeah, absolutely. So we've raised over $250 million to date, which is every time I say that number, I always remember our very first angel investment, where someone believed in me and the company out of nothing and wrote a check for 60K, and I was like, oh my gosh, that's so much money. Wow, like 60K. But it does take a lot of capital to start a healthcare company, and you have to ensure that you're doing it in a way that earns the right to commercialize in what's many times appropriately a very risk averse buying market. So healthcare is one of those undertakings that does require capital in sufficient amounts to get started. So the investors that we have at Amada, we're honored to have great folks from many worlds. In the earlier stage side, great firms like U.S. Venture Partners, Andreessen Horowitz, Norwest. Later stage, folks like Wellington, Rock Springs Capital, Perceptive. And the thing that I'm most proud about is many of our customers have actually invested. And this is always on the back of us having a commercial relationship or a commercial partnership in some way and them seeing impact. So On the provider side, we've had Kaiser Permanente invest, Intermountain invest, Providence invest. On the plan side, Cigna invest, Humana invest, Blue Cross Blue Shield of Minnesota invest, had Quest Biometrics invest. We've had Sanofi invest. All where we've had a customer relationship, and I think that that's a statement. The fact that those folks come from so many different worlds on the moment of convergence that we're having right now in the U.S. healthcare system between different disciplines.
Yeah, and of course, we are at a very interesting point in time as it relates to capital markets in particular. And we'll come back to that and talk about that a little bit. It's an interesting moment. But let's talk about the business itself. When we think of Amada, uh, you mentioned longitudinal care relationships, chronic care management. Type 2 diabetes is what really comes to mind when we think about the early days of Amada. But more recently, you've really started diversifying. Started going into other chronic care conditions. Tell us tell us the thought process behind that, and what led to, and what are some of the new services that you've launched, and where you're headed with this.
Yeah, no, it's been a real neat moment of transformation, and the newest area is musculoskeletal disorders, and that was through an acquisition of really an incredible company called Vizera. And the rhyme or reason for expanding really has to do with two things. One clinically, Omada is very interested in disease areas where we think our core capabilities can make a difference, and that a digital first approach is the right approach. And metabolic, so prediabetes, type 2, and hypertension. There's a clear answer there. Same with behavioral. Musculoskeletal is quite similar. You can really support people effectively from afar, not always, but in the majority of cases. And clinically, it just felt so clear that there's a huge gap in access and quality and outcomes that digital could help bridge. So that's kind of the first is clinically what's possible and what makes sense for digital, and then the second is the voices of our customers. So every single year at our customer summits, we always ask, if you were writing our strategy, what would you want Omada to do? How might we better serve you? What needs do you have? And we got pretty persistent feedback that they wanted Omada to do more and broaden our offerings to other areas. And the benefits that customers see to that is it's a single company to work with, a single contract. It simplifies implementation and enrollment, but there's also a lot of clinical comorbidity. So you can create really neat coordinated care experiences by having an integrated suite in these critical longitudinal areas. So that ask kept ringing loud and clear, and that led to Omada's strategy of broadening. And thus far, that's landing really well in the market.
So I assume that there are some synergies with the existing infrastructure and the care teams and so on and so forth. Uh, I as an
Precisely.
entrepreneur myself, I find that if I have to think of one more thing, the mental bandwidth that you need, in addition to the resources and the infrastructure and all of that, can also be a challenge, and especially from a leadership standpoint. If you have to, if you have to pay attention to two more things on top of the five big things that you already have, how do you really manage that? Does that in some sense distract you from the core mission, or is it in some way accretive and you're really able to make the whole bigger than the sum of the parts? I'm just curious to know how you deal with that.
But no, for sure. And I think for entrepreneurs out there that may be listening to this, I think the guidance, and I think your instinct is spot on. The guidance that I'd provide is you really want to earn the right to enter kind of new areas, but don't do it too soon and don't do it too late. So because it does require a lot of organizational transformation to go from one product line to multiple. And it's never a simple journey because you have to rethink, how you staff the product organization. You have to think about how you train and staff your commercial organization, all the subject matter experts from the clinical team that need to become fluent in all these condition areas. So, a couple of tenets that we've worked to progress is, make sure that the time is right. And that was number one. And then two, I call it selective breadth. So, we're not the company that's going to go out and say, well, great, we're going to do everything. We're going to focus on the key needs for our buyers and make sure that within those needs, we're doing a really great job and tying the room together and coordinating, all the care between them in an elegant way. But it is, it's a very it's a very heavy undertaking, and focus is so important for companies as they grow. So you have to
Yeah,
kind of pick, pick the areas.
yeah. Flipping the question from the customer standpoint, they see you as something today, and then tomorrow you are a little more than that. You're offering new services, but maybe they have existing relationships for those new services. But you have a message that is more synergistic, and it's a nice adjacent offering, and so on. Today, what the work that we do in our firm, we're seeing that clients are really struggling to parse all the offerings and all the solution providers in the market. How do you help them sort through some of their choices? When you talked about musculoskeletal, there's a lot of companies getting into that. In fact, it was interesting. I saw the Amazon shareholders report. Jeff Bezos, he made a comment that I think like 40 or 50% of their warehouse employees have some kind of a musculoskeletal condition. I was struck by that.
Yeah,
I was struck by that. So it's obviously a big issue, but there's also a lot of people getting into it. For your clients, how do you help them make the trade-offs and the choices, especially as a new entrant into the field, when there may be somebody out there who's already been doing it for a while? In your case, I know you came in through an acquisition, but if you just take this as a paradigm, how do you help your clients think through
yep.
this?
Well, first, I think it's really important to be flexible. So, and I don't think this is just Omada or just evident of our company and our stories. We've expanded to multi conditions, but you can't index too far on bundling or unbundling. So we have to be able to support a la carte intentions. So if a customer wants to work with us and just kick the tires on Omada and just diabetes, no problem. Just MSK, that's absolutely fine. Of course, we share a vision on why all the infrastructure ties really nicely together, and why it may make sense to deploy more than one kind of program area from Omada, but you have to be flexible and kind of be okay with a little bit of configurability, especially in markets where employers may have made some decisions that are great decisions for them. You have to kind of approach it with a sense of humility and really listening to customers, and fundamentally just work to not just show and describe a potential value prop on why the full suite in some might be better than the individual parts, but show it. Show it in the outcomes, show it in the clinical protocols, the rationale, and then hopefully you earn the right to support them in new ways. But you're spot on. It's never kind of an either or, and you do need to remain flexible and true to your original product areas as well.
Yeah, yeah. From a competitive standpoint, last year, one of your big competitors, or at least someone that I think was a big competitor, Livongo, got acquired by Teladoc, and now Teladoc is trying to be that company, trying to offer a number of different things, kind of increasing the surface area, as they say. What does it What does it mean for a company like Omada Health? Do you see them now as your primary? What are your general thoughts on the competitive landscape where you are?
Well, what I always remind people first and foremost is, we're in early innings, and it's funny. I mean, I chuckle a little bit when people shine so much light on Omada or a Livongo, not because we're not doing great things here, but if you add up the numbers of people we've helped, which is in about 450,000 in counting, and I think that when for us it's a little bit more in the pre-diabetes space. For Livongo, it's more in the type 2, and I think it was about the same when they sold to Teladoc. But look at the overall disease epidemiology of metabolic disease. Like we're we haven't done nothing relative to improving the overall health curves and epidemiological curves of the country. So that's a statement on how much room there is to have a lot of players here, and it's a great thing for the world if we're taking different approaches into market, and I think both organizations will be hugely successful. So and I give them a lot of credit, and we do have a common vision. A common vision is that an integrated care suite can make a difference here, and we have kind of our unique approaches and styles, and I think that's to be celebrated. So we're honored to compete with them, and hopefully they feel similarly.
I like it's an abundance mindset. This pie is big enough for many many players, and we're barely scratching the surface. I actually like that whole approach. to the market. But when you look at the markets in general now, the digital health is kind of having a moment. Right? This billions and billions of venture capital money that's pursuing digital health companies. Digital health companies are going through a lot of consolidation, M&A. Your customers are buying your competitors. Maybe in some cases, your competitors are merging with one another. When you look at the marketplace out there, what are the one or two things that you try to keep track of, or keep your finger on the pulse of? What do you like to keep tracking, so that you're able to calibrate your own progress against whether you're on the right track or not?
Yeah, I do. So Larry, the number one is what our employers and plans are saying and telling to us. Like and it's my most refreshing, uh, insightful moments are talking to our customers, or talking to our sales reps that are talking to our customers, or just like staying really close there. Because it's amazing. We've all lived it. We've lived in various kind of walks of industry life. We lived hype cycles. We've lived down cycles, and it's almost too easy sometimes to get caught up in like the excitement of a deal or a merger or a financing, and I always try to remind our employees, like, let's stay just really true to serving our customers or members, and just always think, how can you do that better? All the rest will follow. The rest doesn't even matter. If you're not in a position where you can ignore the cacophony in a hype cycle, you're not going to be in a position where you can stay true to your roots and power through a cycle where there's critique about the digital health space. And expect both in this journey. This is a multi-decades journey. So hang tight and stay measured and focused on serving customers and members, and that's all you need to do. So that's how we kind of keep our truth. But it's a very dynamic marketplace, and it's an honor to be serving as an innovator in this moment, is in transformation of the U.S. healthcare system, because it's a really remarkable time.
Absolutely. And let's talk about the individual segments that you serve. Right? Employers are tired of healthcare cost inflation. There's no secret.
Exactly. Yep.
Health plans are trying to find their way in this mix. Providers are, they have their own unique set of challenges, because now a big part of their marketplace is getting chipped away by telehealth providers and new digital health startups
Hmm.
and so on. So a lot of the primary care marketplace is now up for competition, right? And
Yeah.
so there's a lot of shifts that are taking place. So can you share with our listeners, what is the one common theme that you hear from your employer customers versus your health plan customers versus your providers? Is one thing that strikes or stands out for you when you talk to your customers?
Yeah, so I think that the biggest thing right now, it's refreshing. Omada used to have a very provocative point of view. 5 years ago, I mean, we put out this piece, and we were like, look, in-person care needs to be option B. Why on earth would you drag someone into a waiting room of a clinic unless you couldn't solve their needs safely and effectively from afar? Now, you can't do that in everything. Like, Omada's not going to be doing hip surgeries, but there's a lot that you can do. What's happened, in part thanks to COVID, it was heading this direction anyway, but it's become an obvious that the digital delivery of care is here to stay, and that's something to be embraced, not as icing on top of an existing system, but as a fundamental part of the U.S. healthcare system. And I think tomorrow's payers are going to have network teams that set up networks with digital providers, just like they do. They have network teams that set up networks with in-person providers, and that's common. Everybody, you asked for what's common between all the stakeholders. It's very hard now to find either an employer or a plan or a provider that does not have a digital care strategy, that does not think that digital care and the digital provisioning of care is here to stay, and that's a beautiful accelerant, and that'll yield remarkable transformation.
We've heard that, we hear often that what was supposed to be accomplished in 5 years has been accomplished in 5 months during the first 5 months of the pandemic last year, especially from the point of view of adoption of telehealth and virtual care models. Uh, Now, some say that it went maybe a little too far to one end because of the circumstances, and now some of it is coming back. And there's some equilibrium somewhere in the future, which is going to be both. Right? What is your own view of where we're going to be, maybe 18 or 24 months? What does a hybrid world look like for you or for Omada?
Yep. Yeah. So I think what COVID did is it, exposed huge opportunity, but also exposed some fissures, because you can't trick yourself into thinking that you can do everything digitally. It's I talk, a lot of my friends are now practicing docs, right? And they're doing like asynchronous, digital or synchronous, like digital, like care first. And I'm like, well, how many of your patients that are in the primary care setting, like how many you have to send them to in person? Like fair amount. It's not so you can't accomplish everything with far. Omada is focused on disease areas where we think the bulk of the provisioning of care. I always say the tipping point's 80%. That makes an area clinically of interest for us. The bulk can be done from afar, safely and effectively. So I think that we've learned and what does work and doesn't work, and that's going to help us get into equilibrium. And it's going to be a hybrid. I think we will end up in a world where every single health system, it doesn't matter if you're UCSF or you know Dr. Duffy's independent 2-person primary care practice, you will be doing some form of telemedicine. You'll be
Yeah.
doing video visits, you'll be doing phone visits. Like that's going to persist. And I think what's going to happen, that will just be everywhere. And what's going to happen is companies, like Omada, will just really become expert in things that can augment the in-person care system and really fill in all the gaps. Because the operational transformation, the pricing model transformation, the care team and professional and personnel transformation required to tool up oriented toward longitudinal is quite heavy. So I think some things will be adopted universally at the level of the current provider, and some things will stay kind of in the cloud and in the pocket.
Yeah. Well, if I look at the digital health landscape today, I read somewhere that there's over 5,000 digital health startups in the market, give or take. And there's obviously a lot of VC money that is out there. And
There's a
today,
lot. Yeah.
you can go out and what used to be maybe a $2 million Series A is now a $20 million Series A.
It's true. Yeah.
Yeah. I mean, the
Yeah.
definition of Series A. Again, I'm not in the market, but just
Yeah.
what I read, the numbers are just mind-boggling. What do what is your advice to now? You've been in the business a long time, so you've kind of seen some cycles. You've seen the ups and downs a little bit. 10 years is a
Hmm.
long time, relatively speaking, and
Yep.
you've seen, you've got a degree of stability. But what's your advice to startups and indeed to VC firms who are getting into the digital health
Yeah.
space today?
Yeah, well, there's things that I think I'm excited. I like to see the capital in the space. I think it's like heck, like let's have a lot of smart minds run at hard problems and innovate and see what happens. And the beautiful thing about the world of entrepreneurship and venture is, by definition, it's not all going to work. But the ones that do are going to work beautifully. So
Yeah,
I love that that's the case. Now the guidance I'd give today that I think is consistent with the guidance I'd give 5 years ago, and one and what we learned pretty quick is, you in the U.S. healthcare system cannot find a shortcut. You will not be able to like disrupt from the side, go around the system. Like that is not possible, nor should that be the objective. Um, and I always describe the U.S. healthcare system, love it or hate it. There's just some immutable laws of physics that you're not going to be able to get around. You have to learn where the value is, how a dollar flows through the system. You have to be able to deal with the complex, dynamics of navigating, different insurance lines. You have to literally plan a go-to-market strategy almost specific to each state, because the state by state dynamics are completely different. So, when a tech entrepreneur, calls me and for guidance on building an enterprise healthcare business, first I try to dissuade them, because I figure if they do it anyway, then it means they're really passionate about it. But then the second kind of bit of counsel I give is ramp the learning curve, like ask a lot of really dumb questions, be okay with that, and just use appreciate. Don't try to cast judgment on the system. Just view it as it is, and find a way to operationally innovate within the constraints. Like that's the way to get the job done. Like you can't pretend that there's some like magic route. There's just things that are tough to change. That was kind
Well,
of
you just
depressing,
gave it.
but
What you learned in 10 years, you just gave it away. You just gave away the
yeah.
secret sauce now.
I'm a
Uh,
huge optimist. I believe I'm a believer, but you also have to be pragmatic. So
Yeah, I've heard this, this disruption thing. Again, I've been around in healthcare a while too, so I know that
yeah,
when I hear the word disruption, my eyes roll back a little bit.
does not correlate with success
But
usually.
yeah, yeah. So, but let's talk about some of your customers, right? Especially the health plans. They are going about acquiring a lot of these companies. What do you see as the rationale for doing that? Walmart acquired somebody, Cigna has acquired somebody. The health plans are out there acquiring these telehealth companies. What are they trying to do?
Well, I think they're listening to the same voices that we listen to. Walmart, I guess, is a little bit different here. I can touch on that one, but if you're a health plan and you serve self-funded employers, and your self-funded employers are like, "Hey, what are you doing relative to digital care for my employees? Because I know that's the future." You're doing a calculation, and you'll think through, well, what are the pieces that I want to have in house fundamentally, and to bring value to my customers and integrate with my additional services, and what are the pieces that I want to partner and find great companies to work with. And people will come to their own determinations. But I think it's an exciting time in the space. And then I love the new entrants. Like, it's so fun to watch a Walmart come in to care in different ways. An Amazon, a Google. It's really exciting. Um, I think Walmart is going to do just extraordinary things for care for the country. As are many of the plans making bets and innovations here too. So
You mentioned Amazon. I did want to talk about that briefly. Again, Amazon is among the big tech firms a little bit different because they are directly getting into the healthcare space as opposed to the others who are more about offering the
mhm.
technology
Enablement, yeah.
platforms
Mhm.
on which you can deliver care more efficiently. So,
Yep.
what does that mean for incumbents in the space? And again, Amazon's success is not foretold because they've had one very visible failure in the form of Haven, but Amazon's doing 50
Hmm.
experiments
Hmm.
at any one point in time. And so,
Yep.
what do you make of that? And what is your view of the big tech firms and the role they're going to play going forward
Hmm.
in how care is delivered in future? The whole transformation that we're seeing.
Yeah, no, for sure. So I think I think what naturally tends to happen now, I have zero inside information in any of this, but I think what naturally tends to happen is companies end up being excellent in the things that are on the back of their core strengths. So, I think you look at Google, like they solve computer science miracles. I think their approach to developing incredible machine learning and artificial intelligence models to look at radiological data and help augment clinicians' interpretations of readings is extraordinary. I think like that sort of like deep computer science meets biology work, I think will likely be where Google makes its biggest contributions. On the Amazon side, I think it's really complex, supply chain and operations. And the acquisition of PillPack and the pharmacy is kind of a great example, and Amazon Pharmacy is a great example. And then Amazon Care, I'd put it in the same category. It's very logistically complex to deliver care at all digitally, and Amazon has kind of a very unique approach, which I think is a beautiful approach, which is really listening to the pragmatics of care delivery and recognizing that you do need in person, and they have the ability to like have someone show up. And Amazon has a really neat learning mindset. Like they like to approach a market with a very strong sense of customer centricity, and I think they're learning the details and the specifics that um, others have maybe tripped on in the past. And I think in time they'll be very successful. It's not going to happen overnight. It's not like
Yeah,
if you take the average benefits leader, it's not like, oh great, cool, Amazon launched Amazon Care, I'm going to go buy it. Like, yes, they'll be interested in learning more, but it's not, even for Amazon in this space, it's not going to be overnight. But that's a patient business, and that's a business that's willing to put a lot of capital to work to ride out whatever time periods it takes.
yeah. Well, we're coming up to the end of our time, and I wanted to touch on one topic, which is the whole regulatory environment and the
Yep.
reimbursement environment. Right. It's, healthcare, it's always about following the money, right, at the end of the day. And so, uh, telehealth, we've seen some of the waivers come in. They're not permanent yet, but the hope is that they will be there. We're seeing a shift from traditional payment models like PMPM to slightly different alternatives and
Hmm.
emerging models. Firstly, what is your view on where the reimbursement environment is headed today in the market? And if there's one thing that you would like the regulators to address, what would that be?
Yeah, so I'll hit it right out of the gate because actually my biggest worry relative to the inability or potential for us to seize the opportunity that COVID's presented to transform healthcare. And what we don't want to end up happen is wonderful. Now all of a sudden we're doing fee for service through video, and we call that success at the end of the day. And it's now, oh great, clinicians can now bill through a video visit or a phone visit. That is not the end state. And what people sometimes forget in the nuance here is the destination is really allowing for flexibility in service models that can accommodate either synchronous interactions or asynchronous interactions. People sometimes forget that a lot of care preference at the hands of the consumer might literally be to kind of text their care professional, email their care professional. So the ask for Medicare and regulators is to really open minds to ways where you can thoughtfully accommodate asynchronous billing models, and there's ways to do it. You can think through like a care episode where once it starts over 15 days, the clinician's allowed to interact in whatever way possible, and that episode is done for X dollars. Like there's creative solves here. Omada's always priced in a different way than fee for service. So our current pricing, it's kind of like, you kind of think of it as Medicare Advantage-esque in that we align with the scope of services that we provide. We have a monthly rate that we charge to provide that, and it includes devices, your primary coach, your certified diabetes educator, your nurse, like whatever services we render inside that. But we retain the flexibility to personalize against the need. And I think that that's what needs to happen for billing models. Like we it would be a shame if all of a sudden we're like, okay, job well done. We've really transformed healthcare. Now clinicians can bill synchronously through video or phone. Like that is not the end state to maximize benefit for people across the country.
That's very well said, Sean. Sean, it's been such a pleasure speaking with you, and we look forward to following your company's progress. And all the very, very best to you and your team.
Oh well, thank you. Yeah, thank you so much, Patty, for having me on the podcast. A huge honor, and anytime we can help you and others, just let me know.
Well, thank you.